everyone. Thank you for joining us for today's webinar, How Employment and Disability Benefits Work Together. My name is Susan Faltynski, and I am the Manager of Community Employment Services here at ADEC. I have been with ADEC for almost 9 years now, with the entirety of that time being in the Community Employment Services Department. I have done everything from direct client supports, program design and implementation, and writing benefit plans and strategies, all the way up to overseeing all program services within this area. Today's presentation is part one of a two-part informational series regarding disability benefits and employment. First, just a couple of things to note. We invite your comments and questions. Please look at the chat box on your screen. If you think of a question at any point, just type it in there and it will be held for the end. We hope to have about 15 minutes for open discussion after the presentation. Today's webinar is being recorded. We will be able to share a link with you after the event is complete. We welcome you to revisit the content yourself and share it with anyone you think that will benefit from it. You will be able to find it on our website, and I believe that we will also add it to our YouTube channel. There will be polls periodically during today's webinar. The information obtained during the polls is confidential and will only be used to guide today's presentation. We will not retain any individual poll information. All right, so let's jump into it. All individuals deserve a chance to make their own choices, including the opportunity to find dignity and meaning in work. When determining whether to obtain employment, it is important to understand that a person does not need to sacrifice the benefits they receive in order to work. If an individual understands what benefits they may be eligible for, how earned income may impact those benefits, and the work incentives available to help them maintain those benefits, they will be better informed when making the choice to obtain employment. Today, we're going to cover the first two items on that list. We will learn about the benefits most commonly received by persons with disabilities and the impact that earned income may have on those benefits. We will discuss several categories of benefits during this presentation. Cash benefits, such as SSI and SSDI, Medicaid and Medicare, the medical benefits, and some of the miscellaneous benefits like housing, food stamps, and waivers. When people hear the phrase disability benefits, cash benefits tend to be the first ones that come to mind. There are many types of cash benefits paid through the Social Security Administration, but we're going to focus on two of their programs today: the Supplemental Security Income, most commonly known as SSI, and Social Security Disability Income, also called SSDI. But before we dive into the topic of disability cash benefits, let's take a quick poll to see what types of benefits you or your loved one are receiving. Victoria, please put up poll number 1.
So it looks like we have 21% for SSI, 7% for SSDI, 0% for both, 64% for neither, and then 7% for unsure.
Okay. So it sounds like most of you are not receiving any current benefits, or if you are, it is the Supplemental Security Income, or the SSI. So we're going to start with the Supplemental Security Income. It's a program, it's funded by the federal government. The funding for SSI comes from general tax revenues. So this is not part of the Social Security taxes that are taken from paychecks or paid by employers. The SSI program is designed to help persons who are aged, blind, or disabled that have little or no income. The money received is meant to meet only the basic needs for food, clothing, and shelter. Social Security Disability Income, or SSDI, pays benefits to you and certain family members if you are insured. This means that you have worked long enough and paid Social Security taxes through your paychecks to earn what is called credits. Sometimes a person will receive benefits through this program, even though they haven't worked. They can be determined eligible if they have a disability that began before the age of 22 and either have a parent who is receiving Social Security retirement or disability benefits, or has a parent that has died but worked enough to qualify for Social Security prior to their death. To be determined eligible and maintain eligibility, an individual must be unable to engage in substantial gainful activity, which is also known as SGA. And we'll talk a little bit more about what SGA is in a little bit. Oftentimes, these two programs are confused with each other, but there are very key differences between SSI and SSDI. Let's take a look at some of these differences. Each has their own eligibility requirements that we've already discussed, as far as being based on your disability or a person's credits earned through employment. The date that an eligible person will begin receiving benefits is different for each program. SSI recipients will receive their first payment the first full month after the date the claim was filed or the date that they were found eligible, whichever one is later. For SSDI, a person must wait 6 months before they receive their first benefit payment. And this waiting period begins with the first full month after the date that Social Security decides that the disability began. This is not 6 months after your diagnosis. The maximum monthly benefit is also different. Since SSI is designed to meet a person's basic needs, it is quite a bit lower than SSDI. In 2020, the maximum SSI benefit for an individual is $783 per month. For a married couple where both are eligible for SSI, the maximum monthly benefit is $1,175. SSDI benefit amounts are calculated based on the amount of credits a person has. And in 2020, the maximum monthly benefit a person could receive was $2,788. Marriage does not impact the amount an individual receives. Now, the numbers for 2021 were just released, so they're not on the slide. Beginning in January, the maximum SSI benefit for an individual will be $794 and $1,191 for couples. I believe the cost of living adjustment was 1.3% for 2021. Now, the average benefit monthly is going to be different. Not everyone receives the maximum amount of either benefit monthly. So the average SSI benefit received during 2019 was about $603. And for SSI, amounts will fluctuate monthly for those that have income. SSDI benefits are static for every month that a person is eligible for benefits. This year, the average SSDI monthly benefit amount was $1,258 per month. Now, for both SSI and SSDI, benefits payments are almost exclusively done through direct deposit, either into a personal bank account or onto a special debit card for those that don't have a banking account. The Social Security Administration has almost completely done away with issuing monthly paper checks. The dates that individuals receive their payment will depend on the type of benefit they receive. For example, SSI recipients will receive their deposits on the first of each month. If that day falls on a federal holiday or a weekend, then you can expect to receive it the weekday immediately prior. SSDI payments are issued throughout the month on either the second, third, or fourth Wednesday of every month, and it's dependent upon your birth date. In some very special circumstances, the deposit will be made on the third day of the month. This would be, for example, if somebody is receiving extra help from Medicaid with their Medicare. Speaking of Medicaid, each cash benefit comes with a health care program. Anyone who is eligible for SSI automatically qualifies for Medicaid. Those who are eligible for SSDI automatically qualify for Medicare after a 24-month waiting period. But we'll discuss healthcare coverage in a lot more detail later on in this presentation. So part of what we want to talk about today is how income may impact disability benefits. But before we can determine how it will impact it, we need to know, what does the Social Security Administration consider to be income? So according to the SSA, any item that an individual receives either in cash or in kind that can be used to meet food or shelter needs is considered income for the month that it is received. There are 4 main types of income. Earned income is just what it sounds like, money that a person is paid for doing work. It doesn't matter if the money is paid through a paycheck or if it's cash under the table. This is the only income that applies to both SSI and SSDI recipients. The next 3 types of income will not impact a person's eligibility for SSDI. Unearned income is any income that is not earned. This includes money from Social Security benefits, pensions, state disability payments, unemployment, interest income, dividends, and cash that is from friends or relatives. The third type of income is in-kind income. This is food, shelter, or both that an individual gets for free or even for less than what the value would be. An example would be if a person is living with a friend or relative that is not charging them rent or allows them to eat food that they haven't contributed to the purchase of. This is not for those that are minors. That situation falls under our final income type, which is deemed income. Deemed income is a person's portion of income from a spouse, parent, or if they're an alien sponsor that they live with. The entire income of that person may not be counted. So what is considered deemed would be the portion that is used to compute the SSI benefit for that month. Okay, now that we know how the Social Security Administration defines income, we need to know what specific income is countable. This is the income that they are going to use when determining how much SSI a person will receive for the month, or if a person receiving SSDI has worked to the point of substantial gainful activity, that SGA that I mentioned earlier. So countable income is determined on a calendar month basis and is the amount that is left over after eliminating from consideration all items that are not income, and then applying all appropriate exclusions to the items that are income. Because this is a broad definition, we must determine what income is not counted. There are actually several types of payments or services that are not counted as income when calculating a person's SSI benefit each month. So first, there are two income exclusions. The general income exclusion is the first $20 of income in a month, earned or unearned. The earned income exclusion is the first $65 of earned income. So that would be money from doing some type of paid work. Then for earned income, they're also going to exclude an additional 1/2 of the remaining amount. So they're not going to count half of what's left after that either. And we're going to walk through an example of this calculation on the next slide. Even though the value of food and housing provided by someone else, like family or friends, can be considered in-kind income, the value of food stamps, home energy assistance, or food and shelter based on need that's provided by a nonprofit agency does not count as any type of income. Money received as part of tax refunds or advanced tax credits do not count as income. But if any of this money is still left over after 12 months, it could be considered as a resource. And then small amounts of money received irregularly or infrequently, that would be like money on birthday cards or at Christmas time, will not impact your eligibility. Or if someone else pays expenses, such as trash, phone, or medical bills for the recipient, that also would not count as income against them. There are also other ways with work incentives that a person can reduce the amount of their earned income and resources that are counted toward their eligibility. But we're going to discuss those programs in depth during our second part of the webinar series, which will be next month. Okay, so let's take a look at an example of the general and earned income exclusions. This is a great example of how earned income will impact a monthly SSI payment. So in this sample, we are going to take a look at Jacob. Jacob lives with his parents, but he is responsible for his fair share of rent and food. He is currently receiving the full SSI benefit of $783 per month, and he has Medicaid for his health insurance. Jacob has been offered employment at a local television studio working part-time. If he accepts the position, he will work 20 hours per week and earn $10 per hour. We can use the following chart to determine how his monthly benefit payments will change so that he can decide if he would like to accept the position. It's all about that informed choice. First, we must determine how much his monthly gross income will be. In order to do this, we are going to take the number of hours worked each week and multiply it by 4.3 weeks. This gives us a total of 86 hours per month. Next, we will multiply the total monthly hours by the amount of money per hour he will be earning, resulting in a total monthly gross income of $860 per month. So because this is money that he's earning from work, he's eligible for both the $65 earned income exclusion and the $20 general income exclusion. We're going to subtract both of those, leaving us with an amount that is $775. So they've already discounted the first $85 of his earned income. They're not going to count that against him. Because it's all from working, They're now going to divide it in two because the Social Security Administration is only going to count half of the remaining amount as income. This means that the SSA is only going to count $388 of the original $860 of income that Jacob would earn at work. Now that we know how much income will be counted, let's figure out how this will change his monthly benefit amount. To do this, we will subtract his countable income, the $388, from the base SSI rate of $783. This leaves us with his new monthly SSI payment of $395. When you add his new income and his new payment from SSI together, he now has a monthly income of $1,255, whereas before he only had the $783 from SSI. So while going to work would lower his monthly SSI payment, he would still end the month with more money every month. Now for SSDI, there isn't quite as much math required to determine if income is going to impact a monthly benefit because the payments for SSDI do not fluctuate. Earned income has no impact on SSDI benefits unless it means a specific amount known as SGA. So that stands for Substantial Gainful Activity. SGA is defined as the performance of significant duties over a reasonable period of time while working for pay or profit. This is measured by a dollar amount, and in 2020, that amount is $1,260 per month. For persons that are statutorily blind, it's higher at $2,110. Now, beginning in January, those amounts will increase to $1,310 and $2,190 respectively. If a person were to earn more than the SGA amount, they would no longer be considered disabled by the SSA regardless of their medical condition. Benefits would then end after 2 further disability checks if they continue to maintain working at a level above SGA. But there are work incentives that can extend a person's eligibility, even while earning above that SGA amount, or that can reduce the amount of income that is counted, and we were going to learn about those during the second part of this webinar next month. Now that we have learned about the cash benefits that persons with disabilities may be eligible for, let's talk about the medical and healthcare benefits. There are 2 main healthcare programs for persons with disabilities. These are Medicaid and Medicare. They are both overseen by the Centers for Medicare and Medicaid Services, but are separate programs designed for specific populations. They both have their own eligibility requirements and offer different types of coverage for those enrolled. Some people may have only Medicaid or only Medicare, and others may have levels of coverage from both programs. Before we look at each program in a little more detail, let's do another poll to see what medical coverage you or your loved one has. Victoria, please put up the next poll.
All right, so it looks like 25% have Medicaid, 0% at Medicare, 8% for both, 67% for neither, and then 0% unsure.
Okay. Thank you. 0 for Medicare, but 8% for both. A lot of times I find that when meeting with people to do these benefit plans, some of them aren't even aware which healthcare they have because people interchange them so frequently. Medicaid is jointly funded by the federal and state governments. In Indiana, there are over 1.4 million residents that have some level of Medicaid coverage. Today, we're going to focus on the 2 programs that are designed specifically for persons with disabilities, and that's Traditional Medicaid and Hoosier Care Connect. Hoosier Care Connect is a healthcare program designed for persons who are age 65 or older, blind, or disabled, and who are also not eligible for Medicare. Persons receiving SSI will also be enrolled in this program. Any person who is enrolled through MedWorks, which that's a special Medicaid coverage, and we're going to go over that in our webinar next month because that's one of those work incentive programs, will also be part of the Hoosier Care Connect programming. Persons enrolled in this program do have to choose a health plan through either Anthem or Managed Health Services. Traditional Medicaid provides full health care coverage to individuals with low income who are eligible for home and community-based services, the waiver, and we're going to talk about that benefit a little bit later. It is also for persons who are dually eligible for Medicare and Medicaid, or people in nursing homes, group homes, and other state-operated facilities. Members of this program must see providers who accept Indiana Medicaid. Even though there are two separate programs, they each offer the same coverages. Both cover the full array of medical needs a person may have, such as preventative care, hospital treatments, labs, prescriptions, and mental health services. They also cover extended healthcare services, such as vision and dental, therapy services, family planning, chiropractic care, and home health or nursing facility care. Now, there might be copays for some of the services, and the copays will be dependent on which program a person is enrolled. For example, non-emergency transportation, like trips to and from the doctor's appointments, pharmacy prescriptions, and non-emergency use of the emergency room can result in small copays, all of which are under $3. Now, the other main healthcare coverage funder, Medicare, is a federal health insurance program. Funding for Medicare is primarily from general revenues, payroll taxes, and beneficiary premiums. It is designed for persons that are age 65 or older, certain people under 65 with disabilities, or people with end-stage renal disease. Coverage under Medicare is based on federal and state laws and varies by each state and even locality. There are some things that must be covered nationally based on decisions that are made by Medicare. Local coverage decisions are made by companies in each state that process the claims for Medicare. These companies decide whether something is medically necessary and should be covered in their specific area. Medicare coverage is also based on which plan a person has. We're going to take a look at these plans individually. So for the cash benefit, SSI seemed extra complicated. For health benefits, Medicare gets a little confusing. Medicare Part A is also known as hospital insurance, and almost everyone who is eligible for Medicare will receive Part A coverage free of charge because they paid Medicare taxes while working. You can buy Part A if you don't qualify for premium free, but you'll pay up to, it could be as high as $458 per month. Part A covers inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care services. There are deductibles, and the amount that is covered for this care varies depending on length of stay and the type of facility. So for example, a hospital stay, an individual would be responsible for a deductible of $1,408 per benefit period. After the deductible is met, Medicare will cover 100% for the first 60 days of each benefit period. Anything more than that is going to result in a substantial cost to the individual. For a skilled nursing facility, like a rehab center, an individual will pay nothing for the first 20 days of each benefit period and $176 per day for days 21 through 100. After that, the individual is then responsible for all of the costs after day 100 of the benefit period. A benefit period begins the day you're admitted and ends when you haven't gotten any inpatient care for 60 days in a row. Part B Medicare is known as the medical insurance. There is a monthly premium for this coverage, and the standard monthly premium is $144.60. If an individual's adjusted gross income is more than $87,000 for a year, they will have an additional amount they are responsible to pay based on their income. Others may have their premium covered by Medicaid if their income is low. There is a deductible for Part B coverage, and in 2020, that amount was $198 for the year. Part B Medicare will cover certain doctor services, outpatient care, medical supplies, and preventative services. Earlier, we talked about how Medicaid covers almost all medical needs a person might have. Medicare is different. Even if a person has both Part A and Part B Medicare, there are still many services that won't be covered. This includes vital medical services such as vision and dental care, prescription medication, hearing aids or exams that are related to hearing aids, long-term or custodial care, and even routine foot care. Those are all excluded from Part A and Part B coverage. Because the coverages in Medicare are limited, a person has additional options under Part C. These are called Medicare Advantage plans. The premiums and costs associated with these plans will vary depending on the coverage provider and plan that is selected. The costs will include the standard Medicare premiums and the monthly premium. The plans are offered by private companies that have contracted with Medicare to provide the Part A and Part B benefits, but most will also offer additional coverages like vision, hearing, dental, and prescription services. And then Part D is an optional Medicare coverage for prescriptions. This can be added to Part A or Part B or both. It helps to cover the cost of prescription drugs, including many recommended shots or vaccines, which, by the way, aren't covered under Part A or Part B. The monthly premium for this plan will vary depending on the drugs that you choose and the plan or provider you go with. There may be additional costs associated with your prescriptions depending on whether you use an in-network pharmacy or if the medications you use are on the plan's formulary. Some people may qualify for a program called Extra Help, and this will assist in paying for the cost of your Medicare Part D. If you are currently enrolled in Part D, chances are that your provider has sent you their new formulary for the upcoming year, because this is the time of year where you want to double check to make sure that all of your meds are still covered and then decide if you need to choose a new provider. Because health coverage is typically tied to a person's disability cash benefit, the insurance benefit can be impacted by earned income. If an individual remains eligible for their cash benefits, they will remain eligible for the health coverage. Sometimes a person will retain their coverage, but may experience an increase in their premium or loss of the extra help that covers their Medicare premiums. There are also additional incentives that will allow a person with disabilities to retain their health care, even if their disability cash benefits are reduced to zero. And we will discuss these programs and work incentives in the second part of our webinar series, which will be held next month. Phew, okay, we've covered the big ones, cash and medical benefits. Let us move on to some of the other benefits commonly received by persons with disabilities that help them maintain their independence. These are often situational benefits, and they're going to be dependent on a person's income, living situation, or even type of disability. We will start with housing assistance, briefly touch on food assistance, and then finally talk about the BEADS Medicaid waiver. There are many types of housing assistance and programs, but today we're going to focus on the two most common ones associated with the public housing authorities. These are Section 8 and public housing. Section 8 is officially known as the Housing Choice Voucher Program, but everybody simply calls it Section 8. This program can assist persons with disabilities to afford decent, safe, and sanitary housing in the private market. A person with a voucher, the Section 8 voucher, may live in an apartment, a townhome, a single-family home, or virtually any type of residence where the landlord will accept the voucher and meets the requirements that are laid out by HUD to be considered safe housing. Local public housing agencies are responsible for administering the vouchers, and eligibility is based on income. In order for an individual or family to be eligible for this assistance, their income may not exceed 50% of the median income for the area. Federal law requires that most of the vouchers be provided to households that are considered extremely low income, which would be about 35% of the median income for the area. The maximum amount of assistance allowable is calculated by the local housing authorities. There are typically very, very long waiting lists for households to receive this benefit. Sometimes the lists are so long that the housing authorities will actually close the lists and not allow other people to be put on them. Locally here, there are monthly lotteries to choose persons to receive the vouchers or to be moved to the top of those waiting lists. What's really cool about the Section 8 program is that the assistance will follow the holder. So a person with a voucher can move freely and take their assistance with them as long as it is to another eligible site. This even includes moving out of town and out of state. Public housing is another assistance program that is designed to assist low-income families and individuals. Public housing is most thought of as those high-rise apartment buildings or the projects, but can be single-family homes. They come in all sizes and types. There are income limits to be eligible for this assistance. 80% of the median income for the local county or city is what is considered lower income, and very low income would be at 50%. Rent in public housing is based on the anticipated gross annual income minus certain deductions, if any. The formula to calculate rent in public housing is whichever is higher, 30% of the monthly adjusted income, 10% of the total monthly income, or the minimum amount of rent that is set by the local housing authority if there is no income. In our area, the minimum amount is between $25 and $50 per month. So the amount of housing assistance a person receives is based on their income. As a person's income increases, their assistance will decrease. This will cause their rent to go up. With Section 8, if income increases to the point of no assistance, they will remain in the program for 180 days, so about 6 months. During this time, if their income decreases, the assistance will resume. If a person does not necessarily need to leave, a person does not necessarily need to leave their residence just because they are no longer eligible for assistance, but they will be responsible for the entire cost of the monthly rent. In public housing, it's similar. As income increases, assistance decreases. This raises the amount of rent that an individual is responsible for paying. If a household's income increases high enough, the housing authority may encourage them to seek a home in the private market or even follow through with home ownership. Legally, housing authorities may evict or terminate families who are considered over income. That means that their income has exceeded 120% of the area median income. In general, though, locally here, you can stay in the public housing unit as long as you continue to comply with the lease, even if you are responsible for the entire cost of the monthly rent. Okay, so that does it for housing. Let's talk about SNAP, which is Indiana's food stamp program. It stands for Supplemental Nutrition Assistance Program, and it is designed to provide nutrition benefits to supplement the food budget of low-income individuals and families so that they can afford to purchase healthy food. And the purpose of this program is to help people with moving towards self-sufficiency. To be eligible for this benefit, a household must fall within monthly income limits. So this chart shows both the gross and net income limits and the maximum amount of benefits a household can receive based on its size. A household does not necessarily include every person living in a single home. It is possible to have multiple households under the same roof. So for example, a disabled adult might live in their parents' home, but they're responsible for maintaining their own household by paying rent, purchasing their own food and necessities. In this case, there are two households in the same home. If the individual is paying for all of those things, they can be considered their own household without his or her parents' income and resources counting against their eligibility. The actual amount of benefits received by a household will be dependent on their specific anticipated income. One thing that I noticed when I was going over this chart, though, is that the income and maximum SNAP allotment increments aren't equal. And the thing with SNAP is there's no specific calculation to determine how income amounts will change your benefits. But they are based on approximately 80% of your income. And you can expect roughly for every $3 that you earn at work, you will lose $1 of food stamps. That's the closest that we can get to an accurate calculation. Okay, whenever possible and appropriate, it is ideal for a person with a disability to remain living within their home and participate in their local community's offerings. Indiana Medicaid will pay for services for individuals who choose to remain in their home as an alternative to receiving services in an institution, such as a nursing facility or group home. Home and community-based services are designed to support just that idea. These programs are intended to assist a person to be as independent as possible and live in the least restrictive environment possible while maintaining safety in their home. There are several waiver programs that are funded through Medicaid, but today we're going to focus on two of them, the Family Supports and Community Habilitation and Integration Waiver. The Family Supports Waiver has an annual budget of $17,300 for services, and the CIH waiver bases the annual budget on factors such as a person's level of need and living situation. Both waivers cover a variety of services, which may include extended employment services, behavior management, adult day services, case management, therapies, respite care, transportation, supported living needs, and actually a lot more. For both of these waivers, in order to be determined eligible, individuals applying must have an intellectual or developmental disability or a related condition that was diagnosed before age 22. The condition is expected to continue indefinitely and meets a level of care that would otherwise be provided in an intermediate care facility. To meet this level of care, an individual must experience substantial limitations in at least 3 of the following areas: mobility, learning, use and understanding of language, self-direction, self-care, and/or capacity for independent living. The income and resources of a person receiving waiver services are considered in determining financial eligibility, but the income and resources of parents are not considered for children under age 18 unless they are seeking Medicaid coverage prior to having a waiver. So parents' income counts toward regular Medicaid, but not to the waiver. The financial eligibility for those receiving waiver services is based on 300% of the federal benefit rate, which in 2020 would put eligibility at $2,349 or less per month. For the community integration and habilitation waiver, there are additional eligibility requirements. An individual must also meet a priority criteria, which may include the death of the primary caregiver with no other caregiver available. The primary caregiver is age 80 or older. They are aging out of residential placement for children. There's an extraordinary health and safety risk. They are moving from an institutional setting, or there is evidence of abuse, neglect, or exploitation in their current caregiving situation. There are financial eligibility requirements that a person must meet in order to be eligible for waiver services. If a person begins earning income and exceeds these limits, they may lose their waiver services. There are several options and special incentives available for persons with income that allow them to earn wages at a higher level and retain their Medicaid eligibility. And we will discuss these special work incentives in the second part of this webinar series. Okay, so please mark your calendars and register for the next webinar in our Family Forum series. It will take place on November 18th at 1 p.m. It's going to use the same program as today, the GoToWebinar, and it will be formatted similar to today's presentation. During that session, we're going to focus on work incentives that will allow individuals to maximize their earned income while retaining their disability benefits. We will also learn about various resource building programs that allow persons that have benefits to save money without worrying about the financial eligibility limits of those programs. And we're also going to talk about government agencies and programs that can assist you with obtaining services to help guide you through the process. ADEC has several certified benefit liaisons that are available to assist with personalized benefit planning and strategies, and would be excited to be able to offer these services for persons that are interested and eligible. My contact information is going to be located on the final slide and on the provided resource list that is for those that would like additional information. And these are some of the references and resources that were used in putting together this webinar that may be beneficial to each of you. Now, a copy of this presentation and the resource list is available for download. And you should be able to find that, I believe it's near the chat box. Okay, so that is the end of our content. Victoria, are there any questions for us to address?
Yes, so there's one. The individual said that I have mental illness that makes it difficult to work. I anticipate taking training for time management and organization. I anticipate becoming able to work full-time eventually. How does this impact my eligibility, and what happens as I become able to transition back to full-time employment?
Okay, great question. So if you are not already working with vocational rehabilitation, I highly encourage you to contact them, and their contact information will be available on that community resource list. You can also reach out to me and I can help you walk through the process. But Voc Rehab will be a great resource in helping you identify what is going to be the best way for you to transition back into the employment world. You can also receive one of these benefits plans that is personalized to help you understand with your specific benefits, how is your income going to, or how are those benefits going to be impacted? And next month, when we talk about work incentives, which one of those are going to be applicable to your situation? It is not uncommon for persons that have disabilities, when given the correct amount of information and the appropriate information for their individual situation, to work their way off of benefits. They decide, it's determined through the process, that they are capable of returning to work slowly over time, given the appropriate supports. So I highly encourage you, if you are not already working with VR, to contact them or me so that we can talk about how to get you into those first steps. Are there any other questions?
None so far. We'll wait a few minutes. If you have some questions, you can type them into the chat box.
And if you guys think of any questions after the presentation, or if you rewatch the presentation and some come to mind, don't hesitate to reach out to me. You can call or email me, and I am more than happy to help in any way that I can.
Okay, I don't think there are any other questions.
Okay, well, thank you everybody so much for joining me today, and I hope that you will join us next month so that we can talk about how we can maximize your earnings while maintaining your benefits. Thank you.